Hello, my name is Juliet Oji, and I want to do a presentation for my project on health promotion. Please, you need to pardon my voice. I'm having cold, but I have to conclude this assignment. Thank you. So I'm talking of health promotion today. I'll go through the PowerPoint slide together with you. So, what is health promotion? When it comes to our mind, just as the name implies, there are different ways of how we can improve our well-being, how we can take control over our health. Basically, that is the layman's understanding about health promotion. So I will put it that health promotion, it relates to how different people are able to take control of their well-being and be in charge of their health. Thank you. So we'll go through some key objectives here on how to enhance physical and mental health, how we avoid sicknesses and injuries caused by diseases, how we have some healthy lifestyle recommendations, as well as how to reduce health inequalities and take part to enhance quality of life. So I'll go through the first section. The model of health promotion is concerned with prevention and cure of diseases. We know there are some diseases that can be cured, while there are some diseases that can be prevented. And we have some that when such diseases have developed, we can only manage it. So we also check out some risk factors known by healthcare providers, and we focuses on diagnosis, prescriptions, and treatment. Example: immunization. Immunization is prevention of infectious disease. It helps us when you have your new baby. We at different stages of the baby's life, the baby have to be immunized over for different kind of diseases. Like for example, we have immunization to prevent uh, what do I call it? We have immunization for children to prevent them from flu, or at least to reduce the chances of getting flu. Thank you. So we also look at the social model. We're aware of the social and economic and environmental determinants of health. We focus on housing, education, employment, and income. For example, change in shelter to reduce respiratory diseases. There are some accommodation whereby if somebody lives there, you have high chances because the ventilation in the accommodation is not conducive for human health, and so many people can't even survive in that kind of accommodation, like people that has asthma, people that are suffering with COPD and all of that. But change of such apartment can help the person improve in his well-being. Hold on for me a minute. So we go to behavior change model. We prompt people to make positive change to their behaviors, like eating habits, exercise habits, having more time to sleep, reducing of alcohol, reducing noise, reduce very high risky jobs that exposes you to all sorts of chemical, reduce taking of fizzy drinks, especially those that are suffering from diabetes. And we got a very good example. The NHS smoke stopping, the stop smoking services in the NHS, whereby our hospitals are working towards being smoke-free environment. So we also look at the empowerment model, excuse me, where we provide opportunities for people in the community to have positive influence on their health and promote involvement in decision making. We organize, excuse me, sorry, sorry, cold is really disturbing me. Yeah, we organize from the pictures on the on the slide 6, you can see we promote people coming together, having different kind of exercise, different kind of community work, just to get involved in promoting their health, their well-being, get involved in decision making. A very good example is the community health education programs we have in Smethwick. Also, oh my gosh. Sorry, guys. This we have a behavioral change also. We emphasize on the modification of behavior of individual. We guidance given by health professionals. We minimize life risk factors. When it comes to behavioral change, we try to compare behavioral change and the empowerment model. So in behavioral change model, we emphasize on the modifications of behaviors of individuals, their smoking habits, their sleeping habits, their eating habits, and all of that. So we also give them guidance by they get different kind of guidance from health professionals to minimize their life risk factors, but it's often a short-term intervention from healthcare professional. But when it comes to empowerment model, it involves strategies for exercising greater control over health decisions. It's people engage in active involvement in decision making. Recently, I heard of in London, whereby the streets of London, where we have drinking water is stored, clean drinking water is stored on different parts of London. That's a very good decision making. Promotes intake of water, so people don't have to stay dehydrated, because you just have water close to you, drinkable water at all time. We promote personal and self-directed learning. We target a wider determinant of health. So the empowerment model is more of bringing people together, more of empowering a particular group of people together to promote their health. Like it could be that a community comes together and agrees that, in this community, the whole community, they will be selling fizzy drink. That's a way of empowering, just an example, but that's a way of empowering the whole community. So the strength of the behavior change is easy to implement because it's more of a one-to-one change. Then it can make fast health improvement because it's individualized. It's good for quitting smoking and weight loss. But the limitation is, people think they make all the decision and maybe permissive of social and economic divisions. Somebody is happy to stop smoking, the other person is not happy to stop smoking. So it's, we all different, and doesn't mean we have to always agree on some kind of decisions. While the empowerment model, the strength is a trained behavior that promotes long-term behavioral change. The longer term, it encourages self-management and independence. It helps to tackle broader health inequalities, where it's more bold, is bigger. It involves a larger part of the community, but it has some limitations that it needs large-scale resources and community engagement, and it may take longer to see results. But my overall evaluation of both models are recovered when used together. The behavioral model can change in a short time, while the empowerment model can facilitate in a long time. We have the NHS health, the, the NHS Better Health campaign. NHS is one of the bodies, well-recognized bodies in the world who campaign for better health. They do so by promotion campaign about achieving the healthiest people. They have the focus area, they have the weight management. They also advertise healthy eating. They teach people what to do to eat healthy. They organize physical activities from time to time. There's smoking cessation. They also got a fantastic team that are in charge of a mental well-being of people. What are the so let's look at the aims and the objective of better health. It motivates individuals to choose healthy lifestyle and prevent unnecessary sickness. Or they say, well, if you can prevent diabetes, why have it? If stopping lot of carbs and reducing of fizzy drink and all of that helps you prevent diabetes, why not? It's better. There's an old proverb that says prevention is better than cure. There are some diseases, if you can prevent it, it's better than having it. Then the objective is it promotes more movement activity. It promotes healthy. So what I'm actually saying are the aims and objective of better health. It promotes healthy health eating. It reduces the obesity rate. It supports smoking cessation. It improves better well-being, minimizing strain on healthcare resources. Give me a second. Yeah. So let's evaluate evaluation of some better health initiative and some of the positive outcome. You raising awareness about healthcare lifestyle among people, accessible online resources everywhere. NHS is the hub of it. Trust me on that. Accessible online resources support simple, manageable, healthy behavior changes. Take part in activities that prevent type 2 diabetes, health diseases, and obesity. But we also have some challenges to evaluation of a better health initiative. Changes in behavior may not be lasting. Others have challenges like income or poor access to nutritious food. There could be differences in engagement among population group. The overall evaluation of better health campaign has been successful so far in raising awareness and thereby promoting healthier behavior. But overall social and economic circumstances may impact its long-term viability. Oh my gosh, my nose. So let's talk about NHS England as one of the big bodies responsible for delivering significant movement in public health through health services, prevention program, and health education. They got some key responsibility, like they deliver healthcare services, they promote healthy lifestyle, they reduce health inequalities, they support disease prevention, and they also improve health outcome for the population. I've also speak about some contribution in improving our health via the NHS. Trust me, NHS has done a lot of work when it comes to disease prevention, the vaccination program, the cancer screening services, the health check, the health education, public health campaign, They got early intervention for assessment of health hazard, the early diagnosis of disease, the treatment or the support of different kind of disease. They help in reducing health inequalities. Services target at vulnerable groups. Community outreach program and accessible health care. NHS provide all of this. Then we look at some evaluation of NHS England contribution. So I'll look at some of their strengths first before we go to the limitation, and I give you my overall evaluation on this. NHS England's contribution, their strength, they ensure access to healthcare for everyone, support prevention and early intervention, and work to identify needs early on, reduces diseases burden, enhance life expectancy and quality of life. However, there are some limitations to this. The money-tight situation can impact delivery of services. It's not a news where we know sometimes NHS got a lot of people waiting on the queue to access healthcare, and not everybody can go for private options. Growing demand for healthcare services in the United Kingdom. In some communities, health inequalities have not been resolved. I give you my overall evaluation. NHS England has a major role in promoting, supporting the prevention, educating people, treating people, and support of public health. I'm going to conclude my project on health promotion, saying the major goal of health promotion is to enhance the health and well-being of everyone. For you to be conscious of your health is also one of the conclusion of health promotion. It is important for you to know the different models that we have explained here to be used to promote health. The empowerment model, the ones I mentioned earlier. The Better Health Campaign in the NHS promotes the health of the population. NHS England is a key enabler for the health of the public. Good health promotion helps to prevent diseases, enhance people's well-being, and build healthy population. I've also attached some of my references. I got some from WHO 2024. I got some from Better Health. I've attached the link to the references, as well as NHS England Public Health. Thank you.